As we hit our 40s and 50s, many of us notice stubborn weight creeping in around our midsection, even if our routines haven't changed. Slower metabolism, rising inflammation, and hormonal shifts might be to blame, but you don't have to accept the outcome. Dr. Samira Umat from Longevity Medical Clinic is back to help. Thank you for being here.
Hey, thank you for having me.
So why is midlife weight gain happening?
So there are many changes. If I can give you an analogy, think of your body as a car or a new house. And years down the road, they're not the same. They require repair. Things are damaged, they have to be fixed, your car has to be serviced, your house needs new paint, new carpet. The body is the same way. You are changing every single day. Your metabolism is slowing down, your muscle mass is decreasing, the hormones are not there to do their job, toxic load is increasing, fat is increasing, and all of these compile to cause the changes that you see, even though you may perceive and feel that you are doing exactly the same thing. People say to me, I eat the same amount of calories.
Right.
Nothing's changed, but your body has changed. Internally, things are very different and your exposures are different. And so you have to accommodate for that.
Yeah, and so very frustrating for people when diets and everything stop working,
yes,
right?
Yes. So when you're younger, what happens is you have a lot of muscle mass in your body and you are used to a certain lifestyle. You can eat a lot of calories, you're moving a lot, your muscle is burning all that fat, and then you can accommodate for a lapse in judgment, if you will. But as you get older, you have degenerative joint disease, you're slower, your metabolism is slow, you have insulin resistance, you have decreased muscle mass, your hormones are declining. And so if you have lapses in judgment, you're still going to have problems and they will be compounded with more prolonged lapses in judgment. So what happens with the decline in hormones is that now instead of your body depositing fat underneath the skin, it is now starting to deposit it inside the organs. The visceral fat is increasing.
Oh.
So a body composition study is very important to show you what is happening to muscle and what's happening to fat, because fat is pro-inflammatory. It will increase inflammation, and the higher inflammation you have more difficult time maintaining your weight. When you're younger, you don't have that problem because you have so much muscle. You have the hormones to build muscle, you're active, and you build the muscle, you eat whatever you can, your body burns it away, and so you maintain a good lifestyle. As you get older, even with that same quality of lifestyle, it's harder.
It catches up on you.
Yes.
And GLP-1s are quite popular right now, so I want to talk about them because you say they have a role to play.
They do indeed. GLP-1 medications have been revolutionary. They have made it so easy for us to help our patients that are obese, where obesity is a chronic medical disease. It is not a cosmetic or aesthetic thing anymore. It is a problem that we must correct if you want to live a full, healthy, active life and enjoy life till the last day you're on this planet. And so GLP-1 medications actually slow down your they slow down your digestive processes. Your brain feels full at very small amounts, so you don't want to eat. You're not hungry anymore. So those combined with hormone replacement therapy now help you build muscle. So the one medication helps you eat less, lose weight. They were designed for diabetic patients and they worked amazingly well and have been around for a long time, but now people are using for weight loss. But then when you combine it with the right other medication, which is hormone replacement therapy, you replace the hormones that are declining. Now you have a powerful combination that will maintain success for you, because what will you do? You will build muscle.
Ooh, so you advocate then at Longevity to put the two together. Tell me why they should go together. You touched on this, but it balances both out, right?
Indeed, it does. The GLP-1 medications help you lose weight, but that weight could also be muscle mass. So you're losing fat as well as muscle, but the hormones help you build muscle. So when you use the hormones with the GLP medications, with diet and lifestyle, which is increase protein in your diet and do resistance training, now you will be successful in your mission. So the combination is there. See, without the hormones, your ability to build muscle is compromised. So you can add protein in your diet, but if you add the hormones with the protein, you're likely to be more successful. Younger people are successful because they have the hormonal balance. Older people are not as successful because they don't have the hormonal balance.
Definitely. So what actually works then in midlife?
Lots of different things. And if you come to us, we will show you how to make it work. Remember, you must go to a practice where they can actually measure. So body composition measurement is very important. Without knowing that, you don't know where you stand. Your numbers are very important. And then with that, if your numbers and hormones are declining, we will replace that for you. And then we will add the GLP medication on top of that with diet, lifestyle, and exercise regimen recommendations. You are likely to succeed because now the tools are that much more effective.
Amazing. Where can people find you quickly before we go?
Longevity Medical Clinic and LM Clinic on website. And we have 3 clinics, Linwood, Tacoma, and Kirkland.
Amazing. Doctor, thank you so much for being here. So interesting.
Thank you for having me.
And so remember, if midlife weight gain feels out of control, it's not you. Go to lmclinic.com to schedule an appointment to explore your hormones, metabolism, and find out what works for your biology. And it's right there on your screen.
New Day Northwest is sponsored by Longevity Medical.